Oh, okay. Um, Good morning, everyone, and welcome to using National Prevention Week to engage coalition members in new community sectors. As many of you already know, and some of you are new to National Prevention Week generally takes place the second week of May. This year, it's going to be May 8th to 14th, and it's got its slogan already set. It's called Strengthen Community, Build Resilience, and Create Hope. And what is National Prevention Week? National Prevention Week is a national health observance sponsored by SAMHSA, the Substance Abuse Mental Health Services Administration, a director of Department of Health and Human Services, to increase public awareness and activity around substance use prevention and the promotion of positive mental health. It is always scheduled the second week in May. This week, May 8th to 14th. And its purpose is to celebrate important prevention work in our communities, an opportunity to raise awareness of both prevention and our local coalitions before the end of school season, the busy end of school season, and summer. And we know summer can be a high risk time for young people, sometimes less adult supervision, and that's often the first time when young people try alcohol and other substances for the first time. So that's one of the reasons it's timed for the timing it is. And National Prevention Week has 3 goals. One is community involvement, to partner virtually or in person with community organizations and thank them for their support of prevention work, to share substance misuse, prevention and mental health promotion information and resources, so resource sharing, and inviting communities to virtually implement, let's move this up a little bit, and showcase effective social distancing and other prevention strategies. So this is the overarching goals of National Prevention Week. And National Prevention Week, that red may be a little hard to see now that I'm looking at it bigger, has daily themes as a way to organize your prevention activities or education that you want to do. These are based on last year's. They usually go in the same order, but be sure and confirm these on their website. They haven't published an update yet. They will be doing that. But generally, Monday is usually preventing prescription drug and opioid misuse. Tuesday is generally preventing underage drinking and alcohol misuse. Wednesday is preventing illicit drug use and youth marijuana use. And we say consider including vaping in that, since that's a common way for youth to use marijuana. In fact, 50% of Connecticut youth who were surveyed by Department of Public Health in the Youth Behavior Risk Survey said that they vape marijuana. 50% of kids who vape said that they vape marijuana. Thursday is preventing youth tobacco use, which would be definitely e-cigarettes and vaping. And Friday is often preventing suicide and promoting mental health. So again, these are the themes that National Prevention Week usually uses. And they're a way for us to organize social media posts or events outreach. Connecticut has a long history of participating in National Prevention Week. And Connecticut has a statewide planning committee, which several of us are here today. It's organized or coordinated by Judith Stonger of the Connecticut Clearinghouse on behalf of DEMIS. And these are just some of the different things that the state planning committee has organized on the state level. Often a governor's proclamation. Last year, we did a PSA with several Connecticut state commissioners talking about the value and importance of prevention. Often there are speakers or presentations. We've done this both in person and virtual speakers, and often through the clearinghouse. There have been 2 health and wellness fairs at the state capitol. There have been several youth video PSA contests, which Danbury has won twice. Shout out to Danbury and their youth council. We actually went to a Hartford Yard Goats game where the PSA winners for that year were announced and broadcast on the big screen. And we had different organizations having tables where they disseminated information. That was a fun event. Last year, we created a NPW mascot, the starfish, and we had a contest to name it. It's Stella the Starfish, and you all can use those logos at any time. Use Stella's logo as a way to promote prevention. The hub down in Region 1 is adds Stella to a lot of the stuff. You go, the hub, for for using that. I have to remember. A lot of local folks use social media, and they either create their own infographics or they use infographics created by the state committee, the state NPW committee. Change the script, mobile van visitations with health fairs and different local communities happened last year. The Connecticut Committee organizes a Connecticut NPW Facebook page for sharing Connecticut news and events. And they also have a website with everything that's happening this year. And both of those are organized through the Connecticut Clearinghouse. So thank you, Clearinghouse. There are coalition coordinator and volunteer trainings like we're doing today. And we created a NPW library toolkit for engaging with libraries last year. And you can access that either through our website, TTask, or you can access that through the Connecticut Clearinghouse National Prevention website. I just realized I forgot to introduce myself. I'm Lisa Mason with TTask, the Prevention Training and Technical Assistance Service Center. I apologize for that. And these presentation slides will be available to you. We will email them out along with a link to the recording. So in case you wanted to share parts of the recording or you wanted to review that, I apologize for that. Okay, what are some of the things that are being planned for this year by the state committee? One thing we're happy to announce is on May 14th, the Saturday, we will be having an event from 10 to 5 at the Discovery Museum at Sacred Heart University, which I believe is in Fairfield. And it's going to be a family fun day. We'll be distributing about 100 tickets. And activities will be planned, fun family activities. And those are still under development. But anybody who purchases a ticket will be able to take advantage of NPW activities as well. Gizmo, the little adorable tiny dog that's the face of the Connecticut Youth Suicide Advisory Board, and Gizmo's Possum Guide to Mental Health, a book you can download for kids and families, and 2 other therapy dogs have already RSVP'd, and they will be at the event. And we will be distributing, organizations are encouraged to disseminate information as well. So there will be more notice, a flyer will be going out. But we wanted to put that down in case anyone was interested in participating. The Connecticut Clearinghouse will once again be driving their Change the Script mobile van to visit different sites. They hope to be at least in every one of the 5 DEMIS regions. If you are interested in doing that, contact the Connecticut Clearinghouse to request a visitation, and you can do that anytime during the year. But often what communities will do will combine that visitation with health fairs, where they'll have different information dissemination going on. Stella the Starfish now has a costume. Region 2 has one costume, and there may be another costume that's being ordered. I'm not sure if it's the Clearinghouse or one of the other RBHAOs. But you can use, and Stella will be at the May 14th Discovery Museum. But you can use Stella the Starfish logo for social media. During National Prevention Week, you can attach it to your emails. You can use it any time of the year. We have Stellas that have National Prevention Week on them, and we have Stellas without National Prevention Week. And the logo is available for download at any time from the Connecticut Clearinghouse. And we will provide links to these things that I mentioned. Student art contest this year. The statewide committee is sponsoring a student art contest to design coloring pages. They'll be black and white with developmental assets theme to really emphasize the importance of the developmental assets. And so we will be having a art contest for grades K-5, middle school, and high school. And we will be distributing winning color pages at Discovery Museum event. We'll be creating developmental assets messages for social media, and we'll update the National Prevention website, the Connecticut website, in the Facebook page. And then also check with your RBHAOs, your regional behavioral health organizations, which we will include a list of those, and you are welcome to plan local events as well. And I'm going to see if I can drop this down. Oh, no, it wants to stay where it wants to stay. So I don't know if there's anybody from the National Prevention Week statewide planning committee who wants to talk more about these items. You are welcome to. But those are some of the things that's being planned statewide. And then local coalitions are welcome to plan events on their own as well, to celebrate the work that they've done or to draw attention and promote both prevention and the coalition. And we're going to give you some different examples as well.
Hey, Lisa.
Yep.
It's Stephanie. I just want to jump in quick just to clarify for just so people to know, the Discovery Museum isn't physically at Sacred Heart University. It's actually in Bridgeport. It's run by Sacred Heart University.
Oh, okay.
So they're pretty close in distance. Just Discovery Museum is in Bridgeport. It's now run by Sacred Heart University, but it's not physically attached to the university or in the same location.
Thank you.
You're welcome.
I'm going to fix that on these slides when they go, before they go out. I'm just writing a note. It was funny. I went to their website. Gorgeous facility, gorgeous facility. Okay, let's see. And thank you, Stephanie. Stephanie is with DMIS, Department of Mental Health and Addiction Services. She's part of the planning committee, so thank you. Local prevention. Local prevention.
Hang on, kind of on right now.
Okay, we're going to ask that person if they can mute. So we don't get background noise. Okay, so one of the things we encourage you to do if you're interested in local prevention, hey, hang on just a minute.
I'll say it. Alan, if you don't mind muting your computer, please, we could hear your background noise. We would appreciate it.
Thank you. Okay, so consider the theme, strengthen community.
Thank you.
Okay, just a moment. Okay. Great, thank you. So one of the things to consider when you're planning local events for National Prevention Week is, consider the theme for the year: strengthen community, build resilience, and create hope. And I think that is both a reflection of what we've all been through with COVID-19 for the last 2 years. But you can also be thinking about how you've strengthened community partnerships, how your coalition is building resiliency in youth and families in the community, and creating hope around substance misuse and mental health promotion. So think about the theme. Use National Prevention Week to celebrate and promote a prevention initiative that you've been working on or that you're seeing success with, or use it to celebrate and recognize partnerships or volunteers. One of the things we encourage folks to do is, if you already have a busy May planned, you don't necessarily need to plan something new, but you could tag your May events with the hashtag Connecticut National Prevention Week 2022, and align that event with one of the daily themes if you'd like. Or you can develop something new for that week. And then also you can use national, both SAMHSA and the state committee create social media posts for each day of the campaign, and you are encouraged to share those through social media. So you have the option of planning your own or using ones, that have already been created. And then think about your strategic plan, if you have one, and focusing on the substances that are identified as priority substances. Or this may be an opportunity for you to focus on one that hasn't been. Say, for example, your priority substance is underage drinking and you'd like to do something about vaping. Perfectly okay to use this week to talk about vaping or the dangers of fentanyl or whatever. So you're not limited just to what you're working on. So just some things to keep in mind. Engaging coalition members and engaging them in a virtual world. Some suggestions we have is continue emailing or using social media to post coalition updates and resources that you're currently doing, as well as things that you may have planned for National Prevention Week, and ask your members to forward those posts either to their colleagues or constituents that they're working with and volunteering with, or friends, community members. Ask coalition members to encourage community partners to join virtual activities if you're hosting those. Include coalition members in adapting coalition work plan activities for virtual use. Groton, for example, was sharing an ID scanner with alcohol merchants to curb curbside purchases, to reduce curbside purchases that were going to underage people. Another group moved to plan naloxone or prescription drug training that they had planned for in person, and they moved it online. And co-facilitate virtual coalition or committee meetings. This is something that we're doing in my community in Southington, where I volunteer. Is many of you already are hosting virtual coalition meetings, but we're also in Southington doing virtual committee meetings as well. And invite coalition members, if they're not already a chair of your coalition, to consider co-facilitating with you. One person can conduct a meeting, the second coordinates the technology. Keep the agenda simple. Email the agenda prior to the meeting. Post questions to engage, or use a poll to engage your coalition members, and ask participants for next steps on activities that you're planned. I think most of us are pretty comfortable now with hosting virtual coalition meetings, but those are some things that you can think about in terms of engaging your members in a larger role. And please do not hesitate to ask questions. I can't see everyone, so if you want to, great. Thank you, Mike. Connecticut Clearinghouse has a prevention listserv. Many of you are already on it, but if you're not, please contact the Clearinghouse and say you'd like to be added. And they will be posting flyers about different National Prevention Week events and initiatives, both federal and statewide. And if you're hosting something locally, you can send them a flyer about it as well, and they'll be happy to post it. Okay, one sector that you may want to engage for National Prevention Week is your youth members. Some of you have youth members who attend your coalition meetings. Some of you have separate youth committees or youth coalitions. Some, like Danbury, have a town-wide youth council made up of youth from different high schools, 3 different high schools in Danbury. And if you have youth or young adults, young adult volunteers or youth peer advocates, this is their chance to shine, where they can recommend technology platforms and design messages that really resonate with their peers. So you can ask them to help or to manage the current social marketing or social media events, and you can tag those with National Prevention Week, or the themes. Last year it was Prevention Happens Here. You can use the Connecticut Prevention MPW tag as well. Create new social media posts using the daily themes. Post a question, share a fact, share data, local data that illustrates that particular theme, link to an infographic, ask the community for responses or comments and shares. You can ask youth to recognize and thank coalition members and youth council members who have really contributed to your work. You can provide a theme and ask coalition members and youth to record prevention messages to it. That is something that the national SAMHSA and PW has had with their prevention pledge. And you can ask people to take a prevention pledge, and they can post their picture with it. They haven't mentioned what the pledge is for this year, but that'll be coming. And you can conduct a youth PSA contest on an NPW theme. Say, for example, vaping is a concern for many youth. That may get them engaged in it, and ask them to use one fact. One science-based fact about that. So it's not just saying don't vape because, or choose, healthy because vaping does this. So asking them to use one fact that encourages them to learn more about the subject as well. So these are just some ways to recognize and engage youth members in National Prevention Week. And if anybody has any suggestions, I'll pause for a moment. If there's anything that you wanted to share that you've done in the past, don't be shy. You all have good ideas. Okay, engaging community sectors. So one of the things, these are just some quick examples. What sector do you want to engage if you haven't already worked with them? Or is there a particular sector you want to strengthen a partnership with? Maybe take them from being a coalition member to creating an initiative with them. So here's just some examples of what coalitions have done in the past. Shout out to Vernon Rocks, who engaged families and their youth council and different community organizations when they created a block party resource fair. They did this 2 years in a row. They had 100 people come out the first year and 300 people come out the second year. This was, of course, before COVID, but they invited a lot of different community organizations to share materials. They also had a lot of fun family activities, like a bounce house. The youth organized this, they had a scavenger hunt, and the youth organized almost like an escape room, if I remember right. And they also had a little passport where each time you went to a table, you got it stamped by the different organizations. So those were some of the ideas. I'm not sure if Cassie is here, but if Cassie wants to say more about that, you're welcome to, Cassie. West Hartford Prevention Partnership, under the guidance of both Ken Plord and David Reyes, they worked with their local library, and they created book lists and displays of books that feature substance misuse or substance use prevention and mental health promotion. They created a book club where they talked about the book Dope Sick. They had a speaker come into the library, and they created bookmarks for libraries to distribute during that week. In fact, I think during the whole month. I don't know, David, did you want to say anything about that?
Nothing additional, like not too much, but we did have a connection to the library because Ken's mother is a librarian, so she had like some networks that we took advantage of. She had friends. Yeah.
Thank you, David. Thank you, David. Yes. So that was, and it gave us the idea the following year to create the library toolkit, which hopefully I'll be able to screen share. Manchester worked with their law enforcement and families with a safe and sober driving event, sort of like a resource fair. Or a health fair, but the theme was safe and sober driving. It coincided with a tragic accident a couple of years prior, where they lost 3 young people. And the mom of one of the young people really wanted to do something to promote safe and sober driving. So this was an event that they did. They had law enforcement doing simulations, and they were distributing information, and they invited other organizations to participate as well. Norwalk, I don't know if Shavana is there today, but one of the things they do a whole blowout, or they did in the past. And one of the groups they targeted that had been a bit of a challenge for them to engage was the schools. So what they did was, prior to National Prevention Week, they created a list of presentations that they could offer staff, students, families, and they offered this to different schools, and the schools said, yeah, we'll take you up on that. So that was a way to get them in the door more and begin and strengthen a partnership with their local schools. They also have done a tremendous amount around suicide prevention, and they offer things both in English and Spanish as well. So that's some of the things Norwalk has done. South Windsor, they were targeting schools and families. And I don't know if Ty is here, but one of the things they did was their youth created youth PSAs during for National Prevention Week that they then broadcast during their morning school news segment over the closed circuit TV. And they also did tabling at high school sports events. West Hartford did that too, I believe, during spring sport events. And East Hampton, they wanted to target families and community members, and they did daily social media posts that their youth peer advocate helped create. And many communities have done daily social media posts on Facebook or Instagram. So those are just some examples of what other communities have done, and we can connect you with some of those if you're interested. So think about, is there a particular sector that you want to engage or you want to strengthen your partnership with? And I will give you a minute if there's anybody who wants to share something that they've done. I know Terry, and now Elle and Danbury, they really worked with their youth council around National Prevention Week, creating youth PSAs, working with the school library. So that's another example of some things. So when we're creating prevention events and messaging, we want to think about what's the goal of the prevention message or activity that we want to do at the local level. You know, is this already part of your strategic plan? Or if it's new, will it support your strategic plan? It doesn't have to, but it's something to think about to reinforce what you're doing. Who is your audience? You know, is it going to be families, parents, young people, community sectors, a specific one? Are there specific community partners you can engage in this? For example, if I was doing a block party, are there community organizations like Parks and Rec or the YMCA or after school programs or Girls and Boys Club that I might want to be able to host them with tables? Maybe they're getting ready for summer event planning. And this is a way for them to communicate with folks and promote some positive youth development activities. Think about what is the best methods for communicating with your audience in a COVID-19 world. What are some of the methods you can use? Who is the best person or persons to speak to your audience? You know, is it going to be youth members? Is it going to be coalition volunteers, community stakeholders? You know, who are some of the people that we might invite to do that messaging for us? And then recruiting coalition volunteers or youth who are similar to our audience to begin to write the message, to test it for us, ask for their feedback and input as we go, and ask them to help spread the message as well. So these are some of the things for us to be thinking about as we're creating prevention events and messaging. And then these are some of the different resources with links. If you click on these will take you to different links where you can find more information about National Prevention Week. Oops, let's go back. Okay, this is basically in our nutshell, our presentation. What I'd like to do next is to share some of the resources, if that's okay with you. And like I said, you'll be getting a copy of this presentation. And let's see if we can screen share. Okay, hang on. Okay. Usually every year, can you see this? Okay. Usually every year, the SAMHSA will put out a toolkit for National Prevention Week. Oops, I just put up Norwalk by mistake. Well, let's talk about Norwalk. This was, sorry about that. This was a copy of what Norwalk gave in 2017 to the school system. And to other folks. They had a one-pager that talked about what National Prevention Week and the local coalition and contact information. And let's see if we can get this to work. No, I think I'm going to have to. Oh, it did work. Okay, and this was just an idea of some of the trainings and initiatives or presentations that they could offer. So it gave this, you know, a menu, if you will, for the high school, middle schools to choose from. So this was a list that they gave out prior to folks. So that was something that I would be happy to share with you all. And, you know, gives you an idea both to help you with planning, but to also to give a list of ideas. Now, they may not have done all of these, but these were things that people could select. Okay, and then let's find, okay. Hang on just a minute. Okay, just a minute. Let's see if I can, hang on. Oh, you can't minimize when you're hosting. Okay, what I had hoped to do was share the link to the National Prevention website. And there's a whole list of things that you can do. They have a prevention toolkit. I don't know if I can do it this way. Hang on. I don't know if it's going to let me do this. Hang on. Just a second. Maybe it will. Nope, cannot download information. I forgot. You have to pull these up prior to. I pulled up a few of them. But anyways, you can go to their website and they will have multiple pages on National Prevention Week, including a toolkit you can download, the daily themes, what the prevention challenge is for the year. The only thing they have updated right now, currently, I checked last night, was the theme. But as we get closer to the date, they will have more up-to-date information. Connecticut Department of Mental Health and Addiction Services will have connections to that. And they also have, along with the Clearinghouse and drugfreect.org, 3 or 4 of the state-sponsored social marketing campaigns, the Live Loud for opioid prevention, intervention, and treatment campaign, the Change the Script campaign, the Let's Mention Prevention campaign around underage drinking prevention and safe hosting. Safe home, safe hosting. So those are some of the examples. So one of the things you can do rather than create your own campaign is use one of the state sponsored campaigns or the national campaign, Talk They Hear You. And that's on the SAMHSA pages as well. If you Google SAMHSA Talk They Hear You, you'll get information, and they've updated that with new materials. Connecticut Clearinghouse is going to have its own page for Connecticut activities, and they will be posting flyers to the Discovery Museum event, along with any new social media they create, any fact sheets, and you can go. They still have last year's page up. So go to Connecticut Clearinghouse NPW, Google that, and it'll bring you to the page. So you can take a look at what's there. Many of the Connecticut Regional Health Action Organizations, the RBHAOs, there's 5 in the state. And if you're not familiar with them, we'll provide a map, the Connecticut map, so you can check where you are and who's your RBHAO. They we'll be doing some local, some regional events, Governor's Prevention Partnership. Thank you, GPP, for taking the lead on creating Stella the Starship, Stella's the Starfish, and taking the lead on designing that and helping with the costume. And then, of course, TTAS, there's us as well. And we have the library toolkit along with the Connecticut Clearinghouse. And we can connect you with different coalitions as well. So these are just some of the resources that are available to help you, and some of the web pages that you may want to check out for different events. And the nice thing about, of course, we don't know where we're going to be with COVID come May. So it's a little tricky to plan activities or speakers. But one of the nice things is it will be a nice time of year. So if you are planning on doing something and doing something outside, that may be a possibility for you. Okay. Let's see, we're going to stop this screen share. And we will go back to people mode If you want to put on your camera, you're welcome to. If you don't want to, that's fine. But I wanted to open this up for questions and comments. Oh, thank you, David, for posting the national, the SAMHSA. And slides will be going out. Okay. Just want to check the chat box. I wanted to leave some time for questions or suggestions for people. This is your time to be able to ask what other folks have done, or if you have a question about a particular sector, or if you want to share something you've done. Yep.
So this is Mike from Connecticut Clearinghouse.
Welcome, Mike.
Specialist. Hello. So I just want to let you know, if you guys are having an event, we do have the Change the Script van. It's obviously free. And we would come and bring the van, and we'd have a table of information about our Change the Script program and material. So just want to throw that out there.
It's they're bringing the health fair to you type of things.
Exactly.
Okay, Janelle just said something. Janelle, did you want to talk about this more?
Yeah, sure. So last year in Bristol for the National Prevention Week, two of our pretty successful events we did. The first one was a mobile pop-up Narcan trainings at our local parks, and we partnered with the Clearinghouse Change the Script van, and we went to a few of our parks and talked to the community about Narcan and the importance of knowing how to use Narcan. My biggest comparison is very similar to CPR. You may not have to use it, but you never know when you have to, so it's good to be it's good to have the knowledge and to have Narcan on you. And another thing that we did last year was a knockout basketball event. So we did that with some community kids. We played knockout with them, and then we talked about the importance of knowing about substances and where to go to get help, and that we're available for programming or any questions they have. And then we have the adults come and have like a little basketball tournament, which is a really great, the community came out and we passed out flyers and things like that, and information about BEST, the coalition. So those were two successful things we did last year.
Thank you, Janelle. It was a little tricky to hear. I'm going to paraphrase real quick, if that's okay, and correct me in the chat box. But one of the things you did was you took, you had the Change the Script van from the Connecticut Clearinghouse go to a couple of parks where you talked about Narcan and gave out information. Public parks is a great idea, and I've been to the public park. My son loves to skateboard there at the one by the baseball stadium. I forget the name. Rockwell, I think. So, and I've seen the DPH vaccination van there. So I know that's a well-attended park. So you did that, and then you did Knock Out the Stigma, where you went to did you go to local baseball games?
Well, no, we did a basketball tournament. My speaker is not that great, sorry.
Oh, okay.
The basketball tournament at one of our parks. Park Recreation is our fiduciary, so we have a great partnership with them. So we went to one of the local parks and had a basketball event with the community, and it was a few hours long. We passed information, things like that.
Okay, thank you. Thank you. Would somebody else like to share? And if it's okay with you, Janelle, what I'll do is I'll add that to what you did to my PowerPoint presentation, if that's okay with you. Super. Daniela, were you going to speak?
Hi, yes. So Daniela Arias here from the Hub, RVHAO for Region 1. Although it wasn't a specific event, what we did, the Hub, we created a calendar for actually the entire month of May, which is Mental Health Awareness Month, but specifically for NPW. And what we did was we gathered all events and things that were going on in the region and throughout the state and made a calendar so that it was easy for everyone to access it. And it was online. So a lot of things were virtual last year. So it was like registering for Zoom links where they could sign up and things like that. So that we found to be super successful with everyone wanting to share their events. And then we were able to share it and get the community involved, all the communities throughout the region.
And did you post like LPC events or local coalition events? Okay, super.
Yes.
What a great idea. So that way, for example, if Norwalk was interested in something Stanford was doing, they could attend that event, and get a bigger audience. All the different, local prevention councils, the LPCs or the coalitions, could promote to a larger audience as well. That's a great idea. And one of the things I know, some of the smaller coalitions down in the southeast corner, Westbrook, Old Saybrook, Clinton, and some other LPCs and coalition, one of the things they would do is co-host different events as well, with the idea of getting a bigger audience. Why repeat the same thing? So they would collaborate on, because they're smaller communities, and collaborate on joint ventures, if you will. So Daniela, thank you so much. And I assume, Daniela, you'll be doing that again this year, creating that.
Yes.
Super. And that's something you might think, as a local coalition or LPC as well, is to create a community calendar, for your particular town. There may be other events going on that fit within prevention or youth development or healthy families that maybe you want to highlight. So you could even ask your different sector members, what do you have planned during May that we could host, or that we could promote as well. So that's another idea as well. Other ideas or suggestions that people have done? Or are there any questions about National Prevention Week? And I can't see everybody because some of these, because it actually goes on to 2 pages, so I can't see everybody at once. We just want you to know that members of both TTask are available to help you with planning or idea generation. If this is something you want to do, we also have several members of the Connecticut Planning Group here. Myself, Terry has been a past member. Are you still involved, Terry? Or because Terry's living the high life in Denver now, but continues as a consultant to Danbury. Stephanie Moran is part of the group. I'm just looking quickly. Kelly Lepard is part of the group, the planning group. I'm just seeing Daniela from the hub. I'm just looking to see, is there anybody else I'm forgetting? And we are not an exclusive group. If you would like to join us, we meet virtually, usually the 2nd or 3rd Tuesday. I think the next one is February 18th. I can get the time, and I can actually put that in the follow-up email that I'll send you along with the link to this recording, and the PowerPoint slides. So if you want to join that meeting, you are more than welcome to. We have state people, regional, and local people on the planning committee. So we're always trying to think of, how do we promote this? How do we engage people in the initiative? And that's sort of it. Do people have any suggestions or questions? Comments about getting involved? This will be SAMHSA's 11th year. They celebrated their 10th year last year, and Connecticut has been involved in this at least 5 or 6 years, maybe more. Stephanie, is it more? I can't remember. How long.
It feels like it is, but I'm not sure.
Yeah.
To be specific.
I have records from 2017. I don't know if it goes back further than that. But so Connecticut and they're usually, SAMHSA's usually interested in what we have to do too. We share with them. So those are some of the things. So I just want to thank everyone for attending today. We're actually going to get you out a little early. I will hang on here if anybody would like to talk in a smaller group for a few minutes. And we will send out the recording and the PowerPoint slides. If not today, then definitely tomorrow. Sometimes it takes a while to download the recording and get it up to YouTube. If not today, definitely tomorrow, along with the resources we mentioned. So have a pleasant day and let us know what you're planning for National Prevention Week if you choose to participate. So have a splendid day, everyone. Take care. Stay safe and healthy.
Lisa, I'd like to talk to you just momentarily if there's
Absolutely.
opportunity. Okay.
Absolutely.
We'll wait and see if anybody else has.
We'll see if anybody. Hi, Shay.
Yeah, sorry, my camera's all wonky again.
Oh, don't worry about it. Don't worry.
See ya.
I just got the most adorable text message from my mom that kids had a half day at school. So I said, can you pick her up? And I just got a message, we're doing lunch. Good for them. And I'm going to stop the recording. And let me push that button and not the end.